Hello, everyone. Welcome to the Diverse Thinking, Different Learning podcast. I'm your host, Dr. Karen Wilson, and I am thrilled that you are joining our conversation today. We are actually continuing a conversation we started last week. Last week, I spoke with Stephanie Trenum about language development and how everyday activities can be used to help develop language skills. And today we are continuing the conversation about language, but we are going to talk about how speech language therapy can help students with dyslexia. My guest today is Nancy Rose Steinbock. She is a speech language pathologist and an expert in the field of language and literacy disorders. She has over 40 years of experience in the field and regularly engages with experts in the fields of language development and language disorders. She is going to talk to us about the link between language development and literacy. This is a really great conversation, and I'm glad you're here.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hi, Nancy. Welcome to the podcast.
Hello, Karen. It's a pleasure to be with you today. I'm really looking forward to having more conversation with you.
I am excited too. We've been talking for a while, dating. I think it's been months, maybe almost a year that we've been communicating about language and dyslexia. And I really wanted to have you on the podcast to share your expertise, your insights with our listeners, because I just think that information, the conversations that we have been having have been so valuable to me. And I just can't even imagine what that impact would be on families who have a child who's struggling with language development, language acquisition, literacy. And so I am so glad that you are here.
I'm delighted that we can share our ideas and hopefully our decades of experience, mine many more than you since you are fortunate to be still young. But I think it's important. And particularly, I love your background, but the fact that you were very open about thinking about things other than just a multitude of test scores. So I'm pleased to be here with you.
Absolutely. And I love that you said that. And I want to talk about language and literacy because, that's going to be the topic of this podcast, because oftentimes we talk about them separately. We talk about these kids who have these language disorders, and then we talk about kids who have dyslexia. But, you serve kids with language-based disabilities, and there's an absolute link between language development and literacy. And as you say, speech is language and language is speech.
That's right. I think that I could start off, if it's okay with you, by discussing exactly what you were talking about, this kind of separation of language development. And then suddenly we get this label dyslexia. And I remember that I had a wonderful mentor when I was studying. I did 4 years of doctoral work before I left the doctoral studies. But Joel Stark, who unfortunately passed just years ago, was my mentor right up until he died. And he said to me, first of all, because I had, as you know, I was in Italy for almost 14 years and returned to America in 2017. And he said to me, Nan, he said, you're coming back to a testocracy. And in our other conversations, he said to me, dyslexia has become a kind of a garbage can term. So I'm hoping that maybe in our discussion today, we can begin to sort these things through and what it is that we may be missing that will help us in terms of providing comprehensive and effective intervention for kids who need it. And I think we could start with just even talking about the notion of developmental language disability.
Yes, I'd love to start there because I think, the key to mitigating language disorders is really early identification, that there is a difficulty with language development or language acquisition, and then intervention. And I would love to kind of talk about, how do we first identify delays in language acquisition, and then we can go into talking about what is the link between language development and literacy, because it just makes sense that those two would be linked.
Yeah. I think that, again, that's an important concept to be able to speak about. I think the first thing is to make sure that you have in your child's early development and caregiving. Okay. What I'm saying about caregiving in this case now, I'm talking about professionals who may be involved with you, whether it is a well-informed pediatrician. I'm finding family practice docs are really extraordinary. At least I'm finding my experience here locally with regard to looking at the whole person because they're looking across the spectrum. And certainly nurse practitioners or whatever, daycare providers. I think the issue that we need to be thinking about is that we really want to follow the idea that wonderful researchers like Carol Westby, for example, out of New Mexico, with her language and play scale, okay, starting in the school period. But we can begin to, in infancy, begin to put up a little signpost that maybe we need to be watching this child. And I will see this particularly in families. So as an example, a family could have an older child and then a middle child, okay, still a preschooler, but going into maybe the last part of preschool, and then an infant, maybe a few months old. And say, for example, the middle child has come to me because of language problems, but I can already see when the infant is sitting on mom's lap at the end of the session when we talk, how engaged that baby is in communication, eye contact, looking at speakers' faces, following intonation. And what we will often see in children who have developmental language disabilities is that they may lack some of these characteristics of what we consider to be regular or normal. I hate to use those terms, normal and abnormal, but regular language development. And I think that sometimes we will ask our doctor, family practice doc, what do we think about this? And they'll go, oh, it's too early to tell. Let's wait and see. And I think that at that point is when we can already begin to do some intervention by making suggestions. Make sure that you're getting your baby's eye contact. Make sure that you're pointing to things like your mouth or something. Do you know what I'm saying? Just these little things. And again, I think that a lot of times those pass by us. And then we get the 2-year-old who finally might get early intervention. But then you have to worry about, well, what is the quality of that early intervention? And again, any comments that I make are not meant to be derogatory because I think the professionals really are under the gun in terms of the number of people that they have on their caseload, in terms of maybe the philosophy of the agency that they work for that may or may not actually be really supportive of looking at a child as an individual and identifying characteristics of that child's language development or the characteristics of the lack of development that we need to be paying attention to. And I can give you a couple of examples about that if you'd like.
Yeah. And I think that you've said a number of things that are so important. One is that language is not only verbal, there's also some nonverbal ways to communicate, which is also a form of language processing. And then also the idea that you can actually mitigate language disorders by prevention. And by that, I mean that you can identify kids who are at increased risk, either because they have a sibling with language-based disorders, it runs in families, or you notice some of these early signs of kids not attending to language at an early age. It gives you the opportunity to intervene early, maybe not with a formal language therapy, obviously in an infant, but it allows the parents to do some things that will help and facilitate the development of language, which can help decrease the significant delays that sometimes we see later on when there hasn't been attention paid to some of those risk factors.
Yeah, I think that that's very important. And again, it's the idea of just making, but science-based suggestions, okay, on what we know to be, as you were saying, sort of pre-linguistic behaviors that we're looking for. And we also have to consider too, that even within a family, that not all children develop in the same style. For example, my son, who is turning 38 in a few days, he had 150 words at 15 months of age. I mean, it was like amazing. And my daughter, who is planning on going to medical school shortly at age 30, didn't really start to talk in sentences and stuff that we would expect, unlike my son at 15 months of age, until she was a little past 2. But she had this amazing babbling and great eye contact and stuff. And then one day it was just like she started talking. And I remember she was in daycare and the daycare person saying to me, she doesn't say anything when she's here, but she watches and she takes everything in and she participates in play and stuff. But we figured you were a speech language pathologist, so it wouldn't matter. You would know. So I think that one of the things is that when my daughter started talking, she just walked in one day and started talking in sentences. So clearly that foundation was being laid. She had all of the appropriate characteristics that we associate with regular language development, but she just had a different style. And I think that we can certainly consider that, but we have to be very careful about discerning the difference between a child at risk and a child who is moving along, but just has a different style of communication.
Absolutely. And I love that you talked about those pre-linguistic skills and how you can identify them, but also normalizing the fact that language will develop differently in different children. And there may not be anything pathological about it. It's just differences in the way that their language is developing and unfolding. But also the fact that we still need to pay attention, right? We still need to look for progress, look for improvement, have discussions with teachers, with pediatricians, with other professionals who can give parents some insight into what might be happening and how to support children who appear to have a language delay.
And I would say too, let's not blow parents off. I always say mothers are the best diagnosticians. And I think that a lot of times it's just, let's wait and see. And that to me is the same kind of comment as you get in school, slow but steady progress. No, and no. I wouldn't wait too long. I would say, well, let's talk about that. And here are some guidelines that you can follow for the kinds of things that you want to look at or the kinds of things that you might want to encourage in an infant, for example, because there are parents that do have children and they don't know very much about these things, right? That's okay. Not everybody's out there reading books on child development and stuff. But then the second thing is that I wouldn't blow a parent off by saying, it's just so early. Wait till they're 2 or whatever it is. No, you're losing immense amounts of opportunity to develop those kinds of skills that we see that also come along with the actual production of words. And I think that we need to pay attention to that, just as we have to make sure that we're not buying into slow but steady progress, because the kids in the seats around your kid are not waiting for your child to catch up.
That is so true. And we talk about that a lot on the podcast. I talk about that with parents, with teachers, because oftentimes there is that wait and see approach. And oftentimes parents can wait too long because they've been told, they'll catch up, right? And they don't always catch up without some form of intervention.
Well, I think also too that we have to understand that even children without learning problems, as you know, in your profession, intimately, do have periods of plateau. It's perfectly normal. And that's why it appears that these kids who are more at risk catch up. But then what happens is the peers then go ahead and shoot up, because during that plateau period, there's been a kind of a cognitive reorganization, or there's been some sort of a period where, things are beginning to fall into place. And then they are set to move on higher. And then what happens? These kids who have look like they've caught up again begin to fall behind. And I think that we have to be very aware of that and careful about that.
Absolutely. And you probably see in your practice, because you see kids with these language-based weaknesses, deficits in early childhood, the link between language difficulties and literacy later on. So that same child who had difficulties with acquiring language, with sequencing language, they are at greater risk for having difficulties with learning to read.
Yes. And I think that what the area that we really want to focus on with regard to that, say, for example, I get a 2.5 or 3-year-old in who's totally unintelligible. And that kid's been in early intervention or has been in a school program because they've been identified. And I will be told that what happened was I was given an IEP because, IEPs can oftentimes make us all a little crazy. But the mother was told, oh, well, we're not going to worry about X's, speech right now in terms of intelligibility. What we're going to do instead is we're going to focus on getting the child to say more because this child was basically not speaking. All right. And when the child did speak, the unintelligibility was a serious factor. And my position with the mom was, no, we need to develop the phonological system, right, which underlies speech, even when we know that kids do have, some funky speech errors that they make developmentally, all right, like W for R and those kinds of things. But no, we need to get this child's talk, going in terms of being able to say things. And once we begin to get that phonological system developing, then we can get more coding of words and language forms that we use for different communication purposes, whether it's greetings or whether it's turn taking or whether it's making a little comment on an age appropriate book, or, doing play and being able to make a comment about an action or another person's action. So I think that we don't pay attention to that. And then, of course, we know that the phonological system is absolutely critical to developing reading skills, starting with sound letter correspondences.
And that's where I think sometimes we miss the boat with intervention for dyslexia because of the lack of appreciation of the link between language and literacy, where we see a lot of kids getting that support for phonological processing, which we know is absolutely essential. And there's research to support that. But I have seen such great results when children have both the support for phonological processing, whether that be working with an educational therapist, in addition to speech language therapy.
Yeah, I agree with you. And I would say to continue that idea is that what's happened is, and I don't know whether you would agree with me or not, or whether other people with whom you have spoken would, but we have become corporatized. So everything now is a program. So I remember going down to the New York Orton Society in the 70s when you went down and everybody was reading, the red Bessie Stillman, Anna Gillingham book, of which I still have a copy, and learning this set of principles. And so then it was part of language, and then what began to happen is that OG became a program. And so people train specifically maybe in a weekend or a week, and then they get a certificate. But that doesn't mean that they understand the language concepts or the language development underlying that. Does that make sense?
Absolutely makes sense.
And we have this idea that a letter stands for a sound. No, letters symbolize sounds. And this is one of the big issues that we have to get into is that once we get past those early sort of cat and not ka-atta, but cat and being able to move across that word, we have to understand that particularly in a language like English, which is a language that has pulled from so many other languages over the course of its development, that what ends up happening is we've got spelling patterns that represent certain segments. And then we've got the morphology as well. And I think that we give lip service to these things, but I think that one of the mistakes that we've made in teacher education, for example, over the decades, which is like past 4 of them that I've been practicing, is that we're not training teachers in the last particularly decade and maybe before that, in language. We teach them programs.
Right.
And then that fits into the whole scoring situation that we've gotten into as well.
Right. And there's, again, the intersection of language development and literacy. And there's just the synergy between the two. And like you said, you can't compartmentalize those two processes because they build on each other. And it starts with language. And so I have seen such significant improvement in kids, like I was saying, when not only are they working on phonological processing and also building language skills, but when those professionals who are working on developing those skills, because they have different levels of expertise, collaborate, share information, share feedback on how the child is progressing, what that child needs to work on, and then communicate that information to teachers and parents.
That is such an essential, and it's something that I'm really trying to work on. I did find that when I did some short stints, remote stints in schools, that collaboration was very difficult. It wasn't the nature of the intervention because it was remote. It had to do with the nature of the philosophy about what intervention is and what was I doing this intervention, and or talking about reading. Do you know what I'm saying? And one of the problems that I ran into in these settings is administrative issues, that there is a certain way that you're supposed to, everybody's got their role and you don't cross those roles and you don't write goals that could also include moving into literacy because that's not your role. And I think that to your point, again, I don't work in a school setting, but I do have some collaborative teachers that what we need to do, particularly now because literacy rates have dropped precipitously in America. And and where I live, the island where I live, Martha's Vineyard, it's an example of that. And that, of course, is coming from the advent of whole literacy in, the late 90s or 90s, and teaching kids to guess at words rather than how to read them, and then kind of throwing a little bit of phonics at it and seeing what was going to stick. And instead of doing what you and I did, and I certainly did, which was to have a systematic phonics training when I was a little kid in first grade, and also pairing that with handwriting. And we do not pay enough attention to that. We'll give a little bit of time to teaching manuscript and then maybe a little bit of time teaching cursive, but we don't see that as the wire that connects speech and letters and spelling patterns and morphological markers and things. And we don't teach kids those entities in a consistent manner. And so what's ended up happening now is I have kids that they think they come in and they just copy. And I go, no, you're not allowed to copy here. You have to, we're working on this because I use a particular classic set of books. There are wonderful programs out there, but I use an old classic set of books so that they have to work on handwriting. They have to work on actually understanding those segments in a syllable. Like we have the beginning of a syllable, which is the onset. We call it the onset, and that's the consonant or consonants that begin it. And then we have that vowel and whatever might follow to end that syllable. And that's called the rhyme. And so they have to then underline and circle those segments so that they begin to be part of their vocabulary. That they begin also then too, and this is maybe just a kind of a speech language pathology thing, but that they spell. So for example, if you have a word like catnip, you would spell CATNIP. So that you begin to develop these rhythms so that these segments begin to be a kind of a fluency practice as well. And then, of course, following it with clear, precise handwriting so that you actually see that word. And when you look at it, you hear it. So you see it as you're writing it. But when you look at it, this is what we say, speech to print, which is the encoding or the writing process, and then print to speech, which is the actual reading process. So when you and I are reading, and this is what I work on to get the kids in my practice to do, and a couple of adults, is that when you look at that, it's talking to you. And you are moving across those segments. And you're not doing this, but you're actually seeing those segments, so that by working on the phonics, the way I do it, then what happens is they begin to be aware of those segments in increasingly longer words. And this is the kind of thing that we don't pay attention to. As well as then taking a word when you get into the higher level books in this series that I'm using, that I've used for decades, and also for EL acquisition. And then what you do is you begin to build the morphological markers that then build the grammar, so that then people can understand what that placement is and how it's being used to explain or to modify another word, for example. And then also looking at phrases that you don't, because I have kids that come in, and I know that you've seen this too, Karen. They come in and they'll brr across, trying to read as fast as they can. And they don't understand that the print is talking to them, and they need to then convey that talk to their listener, whether that listener is them or whether that listener is somebody to whom they are reading aloud.
And I think that you perfectly described how literacy and language interact and how they intersect, because language is reading, language is writing, and language is speaking. And all of those are developing at the same time, particularly as kids are learning to read. And we always say that kids learn to read, but then they read to learn. And that's where, the language jump is significant in terms of understanding what is on the page. And it seems that when you develop language, when you build those phonological processing skills in students who are weaker in those areas, you are preparing students to be stronger readers, stronger writers, and also having a better, what you say, a sense of self as a speaker, because they become more confident in their ability to express their thoughts and ideas.
I think that you're absolutely right. And, we can always bolster those things with, for example, the concept of the story grammar, and then using like a story map. So a story grammar has, these particular elements that you need to orient your listener to, all right, or your reader who is also listening to your print. I think that we don't pay enough attention to that. And so what ends up happening is you have to teach kids, you need to start out with, let's talk about who's in this story and how they're feeling and where it's taking place. So it's not going to be, they were at at the fair, and no. I don't want to hear that. We want to hear, there was a fair in town and all the kids were going, and this group of kids, or whatever it is that you want to say. And then there's going to be something that's going to start the story off. So once you get past the characters and the setting, then you have what we call the initiating event. Something happens, and it then poses a situation, or we could say a problem, that has to be resolved. And that is a step-by-step process, so that we have ways that we absolutely learn in the course of language development, just in our conversations. But for some kids, it eludes them, because what ends up happening is, because speech and language are difficult for them, sometimes from infancy, as we've already spoken about, they become less attuned to listening, and they become more passive. And by the time they get into school, which might be terms that you would use in your own work, Karen, I describe to parents the concepts of learned helplessness or learned neglect, and that we can see these in different behaviors. I've got one kid who just, does this all the time.
Shrugs shoulders.
Mm-hmm. And we've just started. But again, I don't know.
And I think that's really important, because for kids, when they say, I don't know, I often find that it's not that they don't know, it's that they can't explain what it is that they do know.
Brava. The point to be made is that you're right. And so I use, and it's on my website, this idea, which I had started back in my lab in Italy, this idea of react, reflect, and respond. And I was doing that as part of activism, as I was moving my Italian kids into phonics and literacy and conversation. And so we were looking at, you know, multiple issues, you know, in terms of social problems and those kinds of things in the literature that we were looking at, like Lord of the Flies and things like that. The point that I want to make is that kids, particularly if they've got significant phonological problems, will have significant word finding problems often. Or they may have difficulty getting the syllables in the right, you know, you'll see these transpositions and stuff. So what this idea of react, sit back and reflect and respond. But the problem is if you're in class, you've got somebody always doing this. I know the answer. And then what happens is that you see these kids begin to sort of pull back. Or I think also too, we don't appreciate enough that speech is very rapid, kind of like I'm talking to you now in my therapy, you know, rate of speech. But the fact is that, you know, again, if we're talking, we need to understand that a lot of times for some of these kids, and a significant portion probably, speech sounds like noise to them. And if you've got a classroom where you've got other activities or noise or stuff going on, or just environmental stuff going on, then that is also going to be a deterrent to being able to sit and focus. And then you often have these kids with poor eye contact because they kind of withdraw because it's embarrassing, or they feel stupid, or they feel like they can't keep up. And so you see them just do all of these behaviors that show that they're not engaged. And that's one of the first things that takes me weeks and weeks and weeks in therapy to help kids overcome these very behaviors that are deterrents to learning.
You know, as I'm listening to you talk, and I mean, we could probably talk for another 30 minutes to another hour, but for the parents who are listening, who are seeing some of these difficulties, either with word finding, with shrugging full shoulders, saying, I don't know, and having difficulty expressing themselves. Maybe parents are seeing difficulties with reading, or kids who have difficulty reading don't want to read. And so they're just seeing the refusals to read or the avoidance of reading. What would you say are some things that they can do to advocate for their child with the school, or things that they should be doing at home? Obviously, it seems that they need to connect with a speech language pathologist like yourself.
I hate to say that, but that really is one of speech and language intervention. And to understand that it's not a short process. It's not a 6-month or a 1-year process. It can take several years. As Barbara Ahrens, another very, very fine SLP who is extraordinarily well known in the field, has said, one of the issues is that by the time these kids get to high school, it's like, oh, we don't do speech and language intervention in high school anymore. And of course, that's when you really need that continued support. What I would say is that I think, first of all, it's recognizing that there is an issue. Okay. I think that a lot of times people are afraid to say that their kid has a problem. And then what often happens is that when they go to the school, they might get a 504 designation, the special ed designation, but then sometimes the services. And you have to think about that because teachers are overwhelmed. And as we spoke about earlier before, not necessarily sensitive to their own language. There are a lot of teachers who I've spoken with who said, gosh, I didn't even remember those parts of speech. And I'm thinking to myself, honey, this is the medium in which we are, working and living. And then secondly, I think it's really making sure that we understand that we need to give kids time. You don't say, oh, you know the answer to that. Just say, all right, let's sit back and think about what had happened before, say it's a question about a process or steps in, something that's going down. And do you remember that and again, it's this idea of not asking direct questions, but asking indirect questions and getting the kid to engage as opposed to feeling like they're on the spot or saying to them, you know that, or giving them the answer. I've had parents sit here at the table when I said, please come in. I want you to observe what we're doing. And they'll give the kid the answer. And what we're doing is that then we are taking away the learning opportunity by giving that kid a sense that if they employ strategies to self-advocate, that they will, in fact, gain the floor and at the same time feel more comfortable confronting their challenges and understanding that there are strategies for doing this. And, oh, this strategy isn't quite working. So you work with that professional and you change that strategy to get that kid to where they need to understand that concept. Whether it's, phonics, or whether it's working across a line of print so that they understand how you say it intonationally, because we have what we call paralinguistic cues. And I think that in reading with kids, it's like there's been this whole big discussion about round robin and the fact that it really doesn't work. But what we can do is we can sit down with the kid and say, come on, I really want to hear you read this to me. And then maybe read the next paragraph so that you show what it sounds like. And I think that we don't spend enough time doing that with little kids, getting really great books, classic books, wonderful classic books, pointing to the pictures as you're talking about it and talking about the story before you even sit down and read the print.
I love that. I love that, Nancy. And I love the work that you do. And you're not just a speech language pathologist. I mean, you are an advocate for training, for kids getting the support that they need. And I say not just getting support, but getting the support that they need, because a lot of children are getting support, but they're not getting the support that they need in order to get them to the next level. For families who are searching for support for their child, who may be lagging in speech language acquisition, reading and writing, who may be having difficulties with social language, how can they get in touch with you?
Oh, well, certainly you can get in touch with me through, and I'd be happy to consult with them. Certainly, what you can do is you can contact me through the website. There is a email contact there, and you can always call me. All right. Now, again, we have to deal with time change depending on where they are. But usually middle of the day, Eastern Standard Time is a good time for me because I do EL work in the morning and then I do my intervention because I see mostly school age kids. Well, all kids are in school now, even if they're two. And so then, that goes until the evening. I do work on Saturdays, but again, I could be available in the afternoon to speak. And I would also reach out to the American Speech and Hearing Association as well, too, so that they can refer to clinicians that are also specialized in language and literacy, language development and literacy development, because you want to begin to think about that with that 2-year-old already building in, not only that clearer speech, but also making sure that you're overcoming any like a speech apraxia, which could be a motor, issue that you want to work on. But importantly, getting that kid to understand that speech is the sum of its parts.
I love that. And I'm so grateful again to you. I'm grateful for this conversation.
Wonderful to be able to work like you.
It's wonderful. I love talking with you because I learn so much from the work that you do, because oftentimes we are in the assessment field and we send the kids to experts like you who really can move the needle for them. And I love hearing about the work that you're doing in session with those kids and communicating the progress with parents and letting parents know how they can further support their kids at home and how the interaction between educational therapists, speech language pathologists, and the school are really essential. And I just want to thank you for all the work you're doing to promote language competency and language literacy. And I will be sure to put your website and your contact information in the show notes. So if you're listening, make sure you check out the show notes so that you know how to get in touch with Nancy.
And I also think, too, that we need to make sure, as you have been so kind to do, that we don't talk about the speech therapist. We talk about the speech language pathologist or the speech language therapist, because language is absolutely crucial. And we don't want to just be brushed off as artic folks or working a little bit on grammar and, maybe some pragmatics language use. It should be much richer than that. And it can be. So thank you very much. I'm so appreciative. Okay. Take care. And let's make sure that we're getting these kids diagnosed properly, particularly those kids who are in, situations, neighborhoods, et cetera, where they may not be getting, the diagnosis and intervention that, they need.
Absolutely. Thanks again for all the work you do, and I appreciate you being here.
Well, thank you so very much for inviting me. Really, truly. I look forward to working with you some more, Karen.
Thank you so much for listening. It's always great to interview experts in the field, but even better when it is one of our own Child Nexus professional members. So I'm just so grateful for Nancy for coming on the podcast. I hope that you will jump over to childnexus.com and get on our email list. Our last newsletter had a number of freebies, a number of free events for parents, educators, and professionals. So you won't know about them if you're not on the list. So go to childnexus.com, sign up for our newsletter, and we can continue our conversation. Thanks so much for listening. See you next time.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.